Alright, so this video is for week 32's topic of hospital slash traveling. I do think I talked about the traveling part before, but I'll talk about it again. Anyway, the first question here. Have hospital staff ever treated you differently because you're transgender? No. And I do feel that I'm in a unique position because I work in a hospital, and if I ever am in any position to speak for myself or in a condition that's not life-threatening, I would always request to go to work and be treated. So no, I have never been treated differently because I'm trans, but the people at work know me, and they also know if they're rude at all, I could easily report them. So I have not had any problems as far as that's concerned so far. This says, if not, are you afraid they will? Yes, I am still afraid, because my concern, I guess, is sometimes, like, if a person's unconscious for whatever reason, of course you're not able to talk for yourself and say, I want to go to this hospital. So I do worry that if I'm just taken to a random hospital, that I would be treated badly. And there's something that I wanted to talk about here. I'm going to try to keep it as vague as possible because I don't know how much I can say, but I think without saying this person's name, which I don't even remember, and many details about what was going on, that it won't be a problem. Anyway, this person was an M to F and was presented to the ER unconscious, so they could not speak for themselves, and I guess had not had surgery, even though I'm not positive because I didn't look. To me, that wasn't my area of concern, so I didn't care. But I do remember hearing really rude comments from the doctor about the patient pertaining to their gender, and also from a couple of nurses. So that really bothered me, and now that's something that I always keep in my head, that they'll talk about me that way if I'm unconscious and can't talk up for myself. Anyway, next question. Have you had any trouble traveling because you're transgender? No, not at all, I don't think. Airport security, I just traveled through Atlanta and Florida a couple months ago, and there was no issue at all. So, are there places you won't visit only because you're transgender? I kind of would hesitate to travel to Jamaica, believe it or not. And I know that's random, and that's probably not the only place, but off the top of my head, that's a place that I would be very afraid to travel to, being trans, and especially pre-op bottom surgery. There seems to be a big culture of intolerance there. There's not a lot of acceptance for the GLBT community there, so I wouldn't want to go. I would be very afraid that if something, God forbid, happened health-wise and I had to be rushed to the hospital, that if they discovered that my anatomy was different, that I could have problems. So that is very scary, and I can understand that being a legitimate concern. However, I don't know that it's such a concern as far as airport travel. But I know there for a while they were supposed to start using like a body scanner that actually scanned through a person's clothing, and I could see where that could be an issue, because then they would see. I'm not sure if they would be able to differentiate things under your clothing, but it just is kind of a concern. So anyway, I think that's about all I have to say about that. I think, honestly, being a hospital worker, the best thing you can do if you're conscious and able to speak for yourself is to let them know that I know it could be uncomfortable, but to let them know that your anatomy might be different, and that's also a concern because depending on whether you've had bottom surgery with urethral hookup where you can urinate through your new phallus, you know, that would be a concern because they wouldn't know where to put a bladder catheter. So little things like that might actually be cleared up if you can explain things. And I think it also helps ward off them being able to talk about you because now um, you've made them aware and there's no element of surprise or whatever. So anyway, I think that's about it for this topic. If somebody has any other questions concerning hospital staff or worker, just let me know. Because like I said, I work in a hospital. So anyway, thanks for watching.